Welcome back to our weekly update of COVID-19 things that are happening in Davie County. We want this to be a good resource for all of our citizens and residents of the county to be able to get a weekly update from our emergency operations team and our community partners, and also use this to let you know about some things that may be happening in the community or again, resources that may be of interest to you. At the end of this presentation, as we always do every week, we'll have a link that each of you can get information to us if you have any questions or things you want us to talk about in the future. We look for themes every week and try to respond to our community that way, while also giving those critical weekly updates. And we're going to continue to do this until we don't need to. But right now, because of the changes that are occurring in the county, across the state, across the country, this is a good means for us to continue to get information out to our Davie County folks. So thank you again for joining us this week, and we're going to dive right into our presentation today. So again, continue to get us feedback about this. We want it to be valuable for all of you who are listening. We know that the governor has 3 phases of what we're calling the reopening phases of North Carolina. I know our Health and Human Services Department has been working diligently with the Chamber of Commerce. Ms. Wright may talk about that in a minute. And we're trying to get information out to our individuals and our businesses. We've created a partnership with the Chamber of Commerce where we've placed information on their website about the governor's phases and what's required or recommended or allowed in those in the first phase, and we'll continue to do that for the other phases. But we are trying to provide that as a resource for you. So if you want to see that, feel free to go to the Davie County Chamber of Commerce site and be able to access that information as well. And we'll continue weekly here to get you pertinent information. So with that, on behalf of the county commissioners, we'd like to continue to thank all our citizens in Davie County for all they're doing to help those in need during this time. I'm the county manager again, John Eller, and our assistant county manager, Robin West. We again want to send our thanks to all of our staff as well. And we'll dive into our first resource partner today. We have Mina with us from Cardinal Innovations. And I want Mina to be able to give our Davie County residents a quick update on some possible resources that might be of benefit to those during this COVID-19 issue. We know that behavioral health is a very serious thing, and we know a lot of people right now may be struggling with uncertainties about how they have been impacted and what the future may hold, but also anxiety about where we are and where we're going. And so we thought it was only fitting to invite Mina with us today to talk about Cardinal Innovations and what's available. So Mina, I'll turn it over to you. Thank you for being with us.
Thank you so much, Mr. Eller. I really appreciate the invitation. As you know, Cardinal coordinates behavioral health care for people with Medicaid and the uninsured. And so for us, behavioral health care is substance use disorders, developmental disabilities, and any other mental health illness that comes to mind. And I definitely want to flag that for people listening in case they know of someone who may have recently lost their health insurance. Please give us a call. We do have a 24-hour number that one can reach out to. It is 1-800-939-5911. Again, that's 1-800-939-5911. It's open every day of the year. Language assistance is available. And if it's easier, you can also dial **ask from your cell phone. And that is **ask *275. And so in the Triad area, Cardinal actually covers Stokes, Rockingham, Davie, Forsyth, and Davidson counties. And so that is why we are so grateful to be invited to share some information with you all today. There definitely has been a uptick in behavioral health concerns around the country, and as Mr. Eller noted, right here in our state. So calls to crisis lines, including the Suicide Prevention Lifeline from North Carolina residents, are showing that many callers are actually first-time callers, and that COVID is really that precipitating incident that is making many people seek help, and that there's been a general increase in callers reporting incidences of higher anxiety, depression, and active suicide risk. And so there are some resources locally and statewide and nationally to be aware of. So, of course, you can always call Cardinal, and I just shared that number with you. Anyone can call that number if they are in crisis, regardless of their insurance status or whatnot. But there are other things as well. So locally, there is the Davie location on Hospital Street, and their number is 336-751-5636. They do take walk-ins Monday, Wednesday, and Friday from 8 a.m. to noon. I would encourage folks to call that number ahead of time just to make sure that their service protocols may not have changed due to COVID. Again, that number is 336-751-5636. There is mobile engagement / mobile crisis, which anyone can call any time of day or night. Just be aware that they ask for a 2-hour window to come to you, but a licensed clinician will come out to your location and assess you right then and there, whether it is at your workplace, place of worship, whatever. But that number is 1-866-275-9552. Again, that's 1-866-275-9552. Novant does have a behavioral health assessment center. They are doing assessments by phone only right now, and they do request that the caller have insurance. That number is 336-718-3550. Again, that's 336-718-3550. And the last local resource is the Daymark Behavioral Health Urgent Care that is located off Highland Avenue in Winston-Salem. That is also 24/7, and it is just like what it sounds. It is a urgent care for someone experiencing a behavioral health crisis or someone who has a behavioral health need, and they take all insurance and no insurance. In terms of what's available for first responders, as well as for staff who work with North Carolina's child care programs, the state has set up a helpline called Hope for Healers, and that is, again, specifically for North Carolina's child care program staff, as well as healthcare professionals, first responders, and their families who are experiencing stress from being on the front lines of COVID. And that number is 919-226-2002. That's 919-226-2002. Nationally, there are the Suicide Prevention Lifeline, there's the National Crisis Text Line, the Veterans Crisis Line, the Trevor Project, which is for LGBTQ youth who are suicidal. There's also the Trans Lifeline, which is for individuals who identify as transgender. The National Suicide Prevention Lifeline number is 1-800-273-8255. That's 1-800-273-8255. For the National Crisis Text Line, just text the words HOME, HOME, HOME to 741-741. The Veterans Crisis Line, all you have to do is send a text to 838-255. That's send a text to 838-255. The Trevor Project, 866-488-7386. That's 488-7386. The Trans Lifeline is 877-565-8860. That is 877-565-8860. Some other behavioral health resources very quickly. You can go online to Cardinal's website and take an anonymous mental health screening and get the results. Cardinal does offer a virtual wellness center calendar of free activities like exercise, training, art class, but virtual since we're all social distancing. We also offer a family support group through NAMI, which is the National Alliance for People with Mental Illness, and that seeks to support family members affected by mental illness. And you can contact Julie Whitaker at MISSJULIEYSL@gmail.com for more information about that and how to participate. That's MISSJULIEYSL@gmail.com. There is a coronavirus parenting Facebook group just for parents who are raising children during this very tough time. And then there's also a quarantine chat, which links people who are actually in isolation with other folks who are in isolation. Lastly, and very, very quickly, just some suicide warning signs to be mindful of. If someone is now mentioning that they are thinking of taking their life, they are depressed or sad, they've isolated, their behavior has changed, if they are now using drugs or alcohol, making any last-minute plans, please take those signs very, very seriously and reach out for help immediately. Thank you so much, Mr. Eller, again, for this opportunity. Now back to you.
Thank you, Mina, and thanks for all that y'all are doing for us in the behavioral health world with Cardinal and through your network and through our site here in Davie County. We appreciate you very much. Thank you for being with us. We'll transition now into our schools update. Mr. Jeff Wallace, our superintendent. Jeff?
All right, good afternoon. Mr. Eller, can you hear me? I'm having to operate in a new mode today, but can you hear me?
Yes, sir, you're good.
Great, thank you very much. Good afternoon, everyone. Citizens, thank you for participating or listening in. A couple of updates I have. I had mentioned last week that there would be a new school calendar next year with the start date of August the 17th. A couple of points I want to make sure that everyone is aware of, that there will be 5 additional face-to-face student days added to the calendar, plus an additional 5 remote learning days. That will be better explained once we can get through a little bit more legislative information. But again, the thing that you can count on at this point is school starting on August 17th. The calendar committee has gotten together, which is made up of parents, community members, staff, and there's over 30 people on that committee that have put together 3 options that are being pondered and worked through at this time, and will be presented to the Board of Education to make that the final decision soon. And I hope that'll come out the latter part of this week or for sure next week. Also, the group is aware that House Bill 1043 and Senate Bill 704 was approved, providing some clarity and next steps for across the state, but specifically for schools. Funds have been approved for schools, and we are waiting on specific allocations regarding those funds, but they are primarily directed toward feeding programs, school nutrition, connectivity issues, remote learning, devices, and summer learning, which will be referenced, you may hear referenced as Jumpstart, but that would be targeted, and most all of this money is specifically targeted to particular areas, one specifically being reopening of schools, which at this time is still up in the air. In the last few days, the state of Maryland and Missouri have released a documentation about reopening schools. Maryland's document is 54 pages long. In a conversation or a work session today with the Department of Public Instruction, and I know that the state leadership staff is going through that plan, communicating with Maryland. Want to reassure folks also that we are reaching out, we being the school system and specifically the state school system is reaching out to places like New Orleans and some of their leaders and Joplin, Missouri, where schools were devastated due to weather, hurricanes and tornadoes, and trying to see how to reopen schools. Now, these are a little bit situation a little different than tornadoes and hurricanes, of course, but what it means for our children to be out of school for such an extended period of time. And we're continuing to work on providing quality remote learning opportunities and now until the end of this year. And if we have to start next year or use remote learning next year, if there is a second wave of COVID-19, we are going to be ready for that as best possible. But again, I want to reiterate that remote learning will never take the place of a teacher, a quality teacher, and the relationships that are built there and the learning that takes place for our children while they are in our schools. It is and learning to teamwork and work together and accept other people and different beliefs. So it's we're looking forward to the day we can get back. Also, our school nutrition continues to provide nearly 4,500 meals a day. There's questions about how much longer this current plan will operate. We should get some clarity on that. As our community, most of you may know that we do provide summer feeding for children that are in need, but it's nowhere near to the magnitude that is currently being offered. So there may be a scaling back of that, but again, that would depend on the governor's decisions and what DPI directs us to do. Also, last week I mentioned graduation plans were being made. Well, one of them is absolutely for sure. The Davie County Early College High School will graduate this Saturday, May 16th, with a three-prong celebration and ceremony. With the kids will be able to walk across a stage, an outdoor stage. Will not be able to take their picture with next to their principal, but they will be able to go across the stage and pick up their diploma. And then there will be a parade. I would think Sheriff Hartman and his crew that's going to help out organize a parade for those for the early college high school students. There will be 44 students graduating this Saturday. Davie County High School's graduation, which will consist of well over 400 students. The final plans are being made for that ceremony. Students were given an opportunity. The seniors, of course, the graduates, were given an opportunity to share how they wanted the ceremony to be conducted within the guidelines that was provided by the governor and our state of emergency and social distancing policies. So we have gone through that information that is being shared out with the principal. And again, it's important for us to hear from our students and their parents regarding the celebration. We'd love to have a traditional celebration, but we know we can't. But we will have an exciting celebration, and that information will be announced coming up, hopefully probably within this week, for sure, the early part of next week. And Mr. Eller, that's all of my comments for today. Again, thank you to everyone, and please reach out to us. As you well know, we are serving the greatest thing on this earth, and that's our children. So if we can help, questions, we really strongly encourage you to reach out to us. And again, thank you for this opportunity, Mr. Eller, and that concludes my comments for today.
Thank you, Mr. Wallace. As always, we appreciate all you and your staff are doing right now and all the planning that's going in place for what will come. So we appreciate you very much. We'll transition now on into our Health and Human Services update from our Health and Human Services Director, Ms. Suzanne Wright. Ms. Wright?
Thank you, Mr. Eller. We have 8 more lab confirmed cases of COVID-19 in Davie County. That brings our overall case count to 40. 11 of those remain sick. The CDC has now added nausea, vomiting, and diarrhea to its list of symptoms for COVID-19. I know we talked last week about some additions to the list. They've added 3 more this week. And I'm sure as more is learned about the virus, we'll likely continue to see that list of symptoms grow. The number of patients presumed to be recovered from COVID-19 was added to the state website, and that's at ncdhhs.gov. and that will be found under the COVID-19 dashboard. And this information will be updated every Monday at 4. On Friday of this week, Chamber of Commerce and Health Department staff will join forces to provide guidance on reopening strategies for local businesses. Invitations were emailed out to businesses yesterday, but for more information, please visit the Chamber website at daviechamber.com. And finally, testing and contact tracing continue through the Health Department. So for more information about this and other testing sites in our community, please call 753-6550. Thank you.
Thank you, Ms. Wright, for all that you and your staff continue to do and trying to get information out. And for the partnership with the Chamber, we really appreciate all you're doing there. If you want to do a quick Google search to expound on what Ms. Wright said, you can Google Davie County Smart Restart. And there's information there regarding some of the reopening strategies that she's referring to. But she gave you the Chamber site. That's a great one to go to. There's a lot of information there for our businesses and individuals as well. But Smart Restart is another source of resources for you that you may find beneficial. So thanks for coordinating all that, Ms. Wright, with the Chamber. We will transition now into Sheriff Hartman's update. Sheriff?
Good afternoon, everyone. I appreciate the time to speak. Sheriff's Office continues to operate in a normal fashion. We have not had any major incidents related to the coronavirus. I appreciate Mr. Wallace's thing. We are going to help with the parade, so to speak, for graduation. We've also helped at several birthday parties with officers going to birthday parties or driving by and turning their lights and siren on just to help folks celebrate since they can't get out and about. We are here. And again, I would like to remind everybody about fraud that continues to increase. Be careful, pay attention to what you're doing on the internet and your email. That's really all I have, Mr. Eller.
All right, Sheriff, thank you very much. We appreciate all you and your deputies are doing for us and all you staff in general. Thank you for just trying to spread some cheer during this time. We appreciate you. We'll transition now to Mr. Brian Bird, our Emergency Services Director.
Thank you, Mr. Eller. No changes here at Emergency Services. We'll continue to monitor and follow guidelines as they change. Those guidelines come from the governor, of course, and from our state emergency manager. EMS call volumes have almost returned to normal. There was a decrease for a time due to citizens being afraid to go to medical facilities. And there was also a decrease due to the fact that some of those medical facilities had reduced hours. Those types of things are okay in some cases, but the downside is that patients are staying home and some of them are delayed care that they need. As these restrictions ease, as the COVID case counts hopefully stay low, we hope to see our citizens feeling secure enough and confident enough to go out and get the preventative care that they need. The convalescent service offered by Davie EMS is still available for those that need transport to doctor's offices or appointments. That phone number is 753-6170. I encourage citizens, if they need that service, to call ahead and schedule that appointment so that they can get you to that doctor's appointment. And that's all we have here at Emergency Services today, Mr. Eller.
Thank you, Mr. Bird. We appreciate y'all more than you know. We'll transition now to 911 communications. Mr. Rodney Pierce.
Yes, sir. Thank you, Mr. Eller. Just as Mr. Bird said, we don't have significant updates here at the 911 Center. We do like to remind the citizens of the public information phone numbers that are out, 211, and the state helplines for any questions regarding the government reopening or the phases to the response levels. Also, we will continue to ask our screening questions until that is lifted, so just be patient when you do call 911 for these questions. Like I said, they help to triage for the responders before they get there. Other than that, we're business as usual. Thank you, sir.
Thank you, Mr. Pierce. And last but not least at all, Mr. Johnny Lambert, Public Utilities Director.
Thank you, Mr. Eller. Just just a couple quick things. That Public Utilities is still working underneath the Governor's Executive Order 124, which the main parts of that is we're not charging any late fees or any other penalties for not paying water or sewer bills, and we have suspended disconnections. Right now, this bill last is in order until June 1st, 2020. So we're still urging citizens to call and try to set up payment arrangements if they can't pay their bills, so they're not incurred with a big fee at the end of this. So we're still working underneath that order, and we look for more direction to come out soon about that. Also, there's been information released from the CDC, the Center for Disease Control, about when you're opening up your buildings and the water system. So that water's been setting in the pipes for some time, and it has age to it. So we're really encouraging people to run water through that system to get fresh water in there, so that way it's safe and taste and odor free before they start resumption of their normal water use. So that's all from the Public Utilities, Mr. Eller, and thank you for your time.
Thank you, Mr. Lambert, for all you and your team do for us and trying to keep us safe there. In closing, I just want to say to everyone who may be listening, no one knows how much time each individual on this call today spends trying to do everything that we all can do as a team, but also as individual departments to keep people safe and put planning efforts in place and hope for the best, but be ready and be nimble if anything were to change as we hear continued updates and changes coming from the state of North Carolina. But I just want to thank everybody on this call for all they do. I know they put a lot of hours in and sometimes don't receive the credit that's due to them. And I just want to take a minute here just to say that. So all of you, I can't thank you enough. I'm so proud of you and for what you do to represent Davie County. Blessed to be one of your teammates, and you all continue to inspire me. So thank you. Mina, thanks for joining us today. We appreciate all of our speakers, and citizens, don't forget, if you have questions or things that you would like for us to focus on every week, get them to us at this link here. We'd love to hear from you, and we will wrap this up today and return to you sometime next week on our next recording. So until then, thank you for your time. Thanks for joining us. God bless everyone. Take care.